Hello, my name is Natalie Rosen. I'm a registered clinical psychologist and associate professor at Dalhousie University, and I hold a professorship in sexual health and couples. My research focuses on women's and couples' sexual health, and it can be broadly divided into two key areas. The first area focuses on sexual dysfunction, particularly in women, so looking at problems such as low sexual desire or pain during sex, which are quite common. And the second area focuses on parenthood, so in particular working with couples who are struggling with fertility problems or couples who are becoming parents for the first time. And both of these contexts are areas that can be highly stressful and introduce a number of new sexual problems and relationship difficulties for couples. My research has been impacted in a couple of ways during the global pandemic. The first major impact has been to recruitment of participants. So that has really slowed down during the pandemic, unfortunately. Typically we're there in person, meeting potential participants at the infertility clinic here in Halifax or at the IWK Health Center, meeting expectant and new parents so that we can tell them about the research and develop that relationship with participants so that they feel a part of and invested in the projects. So unfortunately, we're not able to be there in person anymore, and instead have really focused on ramping up our online efforts to reach participants and to speak to them on the phone and in other ways. The other key impact related to the pandemic has been some shift in the way that we ask our questions. So we've added questions into almost all of the projects about sort of the stress and impact of COVID-19 on their relationship, on their sexuality, so that we can account for this novel context when we're thinking about and asking our research questions. To me, support from donors is really essential for increasing capacity for research areas that tend to be understudied and neglected, such as women's sexual health. It allows researchers such as myself to expand the breadth and the depth of the work that we're doing by increasing the available resources that we have access to and increasing our capacity to invest in this area.